Hey everybody, welcome to Pick Dr. Osborne's Brain. We're going to be talking all about pain hacks tonight. So if you struggle with pain, doesn't matter what kind, whether it's arthritis, nerve pain, whether it's autoimmune pain, we're going to be talking about really specific hacks. We're going to be diving into supplemental hacks. We're going to be diving into lifestyle tips and trips. We're also going to be talking a little bit about laboratory hacks, what labs you can ask your doctor to run to really nuance why your pain is there and what you can do about it based on those lab results. So stick with me to the very end because we're going to be talking in depth about those concepts. Now, before we dive in though, if you're new to the show, make sure you tell me hello. Let me know where you're chiming in from. And if you've got questions that are pain oriented, try to keep them related to pain. Tonight's show is all about pain. Go ahead and chime those into the feed right now, and we'll do our best to get those answered if we can get to all the questions tonight. So before we dive into hacks, I want to talk a little bit about background that you should understand. Every one of you should understand about pain. And so number one is we've got a lot of different types of what are known as autoimmune pain syndromes, right? Arthritis, autoimmune pain syndrome. So rheumatoid arthritis, or JRA, which is juvenile rheumatoid arthritis, psoriatic arthritis, lupus, reactive arthritis, migratory arthritis, fibromyalgia, dermatomyositis, AS or ankylosing spondylitis, scleroderma, Raynaud's phenomenon, neuropathy, reflex sympathetic dystrophy. Why do I list all these? Because many of you have been told, you have this diagnosis or that diagnosis, and you're not really relaying that to pain. And so I want you to understand, if you have any of these diagnoses, this show is for you tonight. I want you to stick with me. Also, if you have other forms of pain like headache, chronic headaches, migraine headaches, these are also a part of this autoimmune pain syndrome. Even if you have osteoarthritis, which is what a lot of people refer to as old age, right? Osteoarthritis can actually be caused by some of the same things, and we're going to dive into those hacks as well. So if you've got, again, whether you think it's wear and tear pain, old age pain, injury pain, or autoimmune pain, stay with me tonight. We're going to be diving in. Now, one of the biggest issues behind autoimmune pain, and I'm going to put some research up on the board for you first just to kind of set the table as we talk tonight. But autoimmune pain, a lot of people don't understand autoimmune pain for the most part, in many cases, is largely induced by food. And one particular food, one particular protein in food called gluten, okay, is a big factor here. So if you're new to the show and you've never heard me talk about gluten before and you haven't read my book, No Grain, No Pain, pay close attention. This is one of the biggest factors in pain induction. Now, this is coming from a study published just a couple of years ago in the journal Nutrients. And what you're seeing here, we'll zoom in for you here, this purple area, these are the cells in the architecture of the small intestine. So what you're looking at is the different stages of damage that can occur before a person has full-blown celiac disease. So again, if you're new to this, gluten can cause celiac disease, okay, which celiac disease is defined as mucosal lesions or atrophy of the villi, which is what we're looking at, as a microscopic cross-section of the intestine. So over here on this side, we have flattening of the villi. We have injury of the villi here. We have less of an injury here. And so over here, it's a lot healthier. And then as time progresses, it gets more and more unhealthy looking, right? But what I'm showing you this diagram for is because many of you, you've heard this falsity or this myth that if you don't have celiac disease, then you don't have anything to worry about as it relates to gluten. But this research study compiled how untrue that actually is. What these authors in this study are showing is that you can develop, before you ever go on to develop overt celiac disease, in these earlier stages before the overt celiac disease sets in, you can have arthritis that develops. You can develop autoimmune disease. So all those autoimmune pain syndromes that we just talked about on this prior page right here, the ones that I was referring to. Okay, but that's not all. That's not everything. So you can see over here other pain syndrome. One kind of pain syndrome that very common is peripheral neuropathy. We can get bone loss and arthritis. Okay, so these are pain syndromes as well. And really, technically, you could call dermatitis herpetiformis just the skin. It's painful skin lesions. So it's painful, although not in the way many people think. You can develop tooth enamel defects, which can cause tooth pain and dental issues. You can develop cardiomyopathy, which can cause chest pain and pressure, right? So this is all gluten induced, right? So I want you to see, this is what research has to show, so that before a person fully develops full-blown celiac disease, many of these other syndromes develop, and many of these syndromes induce pain. And I want you to understand that, because a lot of people don't get that concept. They can't make the leap in their mind from, how is it that gluten's causing my back pain? That doesn't make any sense. Or how is it that eating gluten is going to cause nerve pain, right? And so for you skeptics that are out there, this is for you. This is a research study. This was just published in 2020. And so you can see here, this is on a study on non-celiac gluten sensitivity, meaning these individuals did not have celiac disease, but they were sensitive to gluten, and chronic refractory or recurring low back pain with spondyloarthritis features. So in essence, these people with gluten issues had chronic low back pain. And so look what happened in the study, okay? The average age at low back pain onset was the age of 30. So these are even younger folks. We're not talking about people that have lived so long that they're 80 and they have back pain because they're of wear and tear. These are young folks, right? Age of 30. Average disease duration was 15 years. Okay, so from the age of 30, think of that, the age of 30 to the age of 45, still relatively young, right? So we have 79% of the patients experienced improvement in pain when going on a gluten-free diet. 62% of these patients achieved demanding improvement, meaning very, very big improvement. The average duration of the gluten-free diet in these patients with demanding improvement was 60 months. So in essence, the longer they were on the diet, the better their pain levels became. So 60 months, that's 5 years. So some of you are like, oh, I went gluten-free for a week and it didn't help. It's not always that simple. You've got to, if gluten's causing the pain, you've got to keep that gluten out of the diet for a prolonged period of time for that inflammation to subside and for the tissues, the damaged low back tissues, to begin to be able to heal. You see here, as we keep on, 56 out of 69 patients with demanding improvement ingested gluten. Of these 56 patients, 54 months, 56 out of 69 patients, sorry about that, experienced clinical worsening. So again, when they took gluten out, they improved. When they put gluten back in, they experienced clinical worsening. So an important study, because it's, you can see down here some of the diagnoses. So if you've had any of these diagnoses for yourself, out of 28 patients retrospectively classified as having axial spondyloarthritis. So if your doctor's ever told you that term right there, spondyloarthritis, okay, 23 had demanding improvement. Out of 16 with uveitis, which is a disease that affects the eyes, but uveitis also affects the spinal joints, 13 had demanding improvement, and out of 83 patients with fibromyalgia, more than half, 48 had demanding improvement. So fibromyalgic pain fits in that criteria as well. So again, uveitis, spondyloarthritis, low back pain, fibromyalgia, all improving with gluten-free diet. Again, these are, in the words of the researchers, and I've got plenty of research that I've done in my clinic as well, but I want to show you what's been published in peer-reviewed literature. So this study was published in 2019 by one of my favorite authors, Marios Hadjivassiliou. And so they were treating neurological manifestations of gluten sensitivity. And this is another big leap, because a lot of people don't understand, how does gluten cause nerve pain or neuropathy? That doesn't make sense. I eat food and my hands go numb and they start becoming painful and tingly. But it's one of the manifestations of gluten sensitivity. So a range of debilitating neurological manifestations increasingly being recognized in patients with gluten sensitivity with and without enteropathy, meaning they don't always have celiac disease. Even in the absence of GI symptoms, ataxia, which is dizziness, loss of balance, is the most common neurological manifestation, followed by peripheral neuropathy. Very key. I see this all the time in my practice. People have been to the neurologist, they've been to the orthopedist, they've had surgery, they've been operated on, they've gone through physical therapy, they've had chiropractic care, they've had things like acupuncture. None of it worked, right? Why? Because they were eating food that was poisoning their nerves, creating the neuropathy. You can also see epilepsy, headache, encephalopathy, which is swelling of the brain. Various movement disorders, cognitive impairment, and muscle disorders like myalgia have also been linked to gluten sensitivity and celiac disease. Strict gluten-free diet is an effective first-line treatment of the neurological manifestations of gluten-related disorders. So again, if you're a skeptic, don't take my word for it. This stuff is very real, and you need to, if you're struggling with chronic pain, you need to understand that diet change could be a massive improvement in your health. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.